Hi, this is Dr. K. I'm hoping you're all having a wonderful day today. I'm going to share a story later in the video, but I want to briefly talk about the testing initially. So far, I haven't seen any positive cases in the last several days. The volumes have been low in general. A lot of people are not coming into the hospital unless they're really sick. Hi, Lorena. Thanks for watching. So let's talk about COVID testing. It seems the goal has been, or the motive of people who are coming in is to get the test, whether they are short of breath or whether they have fever or cough, or some of them have abdominal pain. No matter what the symptoms are, their main concern seems to be to get the testing, and there are a lot of problems with that. So let's assume you're sick, and let's assume you're truly COVID positive and you have the virus going throughout your system. So if you want to get tested, then what's happening is come out of your house, you're contaminating the car, and if you're in the ER, you're contaminating the ER, the waiting room, and when you're waiting to get checked in, you're probably spreading the virus to the other people who are in the waiting room. Once you're in the room, you're obviously spreading the virus inside the room. That can be clean, and that's usually clean in most places. The healthcare personnel, whether it's the staff, the nurses, or the doctor, when they're seeing you, if they're not wearing the N99 or the mask that can protect from coronavirus, if they're wearing the regular face mask, which is a cloth mask, then chances are they're going to get the virus from you. And what's going to happen is they'll get a swab inside the nose, and then they'll say, if you're not sick enough, they'll send you home, and they'll tell you to wait 1 day or 7 days, depending on where the test goes. So you go home, and once you go home, you're in quarantine or semi-quarantine. And then you get the test results. If it is negative, then everything is okay. If it is positive, you're in quarantine anyway. Now that there's an order from the governor in the state of Florida, now people can't drive anywhere. So in the whole scenario, if you're not sick enough, then you're not really accomplishing anything. It's just that if you happen to be positive and there's a test result in your hand that shows that you're positive, then you can show it to your family and you can start isolating. Maybe you can go to a hotel and stay there for 2 weeks. If your house is big enough, you can stay in one section or one room and not come out altogether. But apart from that, you're actually spreading the virus around. So lately what I've been seeing is a lot of people are getting tested for COVID-19, and so far all the patients that I came across, they're all negative. Some of them get admitted to the hospital, and if they have other illnesses, like if they have heart failure or lung problem, we treat that, and some of them have actual pneumonia from bacterial illness, we treat that. But what's happening overall is, because we're trying to rule out COVID-19, the staff are wearing the mask and all the protective equipment, and they're running out of protective equipment because they're using this equipment for these people. So let's talk about drive-through testing. Drive-through testing seems to be the most exciting thing now these days. A lot of people are going there. But I'll share a story with you. This was shared by another doctor, so I'm not going to give the details, but this is what happened. So in this drive-through location, there was this employee who was testing people for many, many days or weeks. I don't remember. And after a while, this particular employee became sick, and they had developed fever. 99.5, we call it low-grade fever. So this particular person went to the urgent care, and eventually the person, their husband, also became sick and developed fever. So they both were seen in the urgent care. So the urgent care said, you don't have to worry, and the husband was working in a Dairy Queen. And they said, take 3 days off and just chill out at home, and after the fever is gone, you go back to work. So the husband actually did that, which in my mind, it doesn't make sense, but that's what happened, okay? And this particular employee, this lady who's having fever, eventually she was sent home, and then she eventually decided to see a private doctor, a general practitioner, and the general practitioner was really concerned, and he decided to order the COVID-19 testing. Now, I don't have the results back. I can't tell you if it is positive or not. But I wanted to share you like my takeaway from the story is that this particular employee is probably was testing thousands of people with a swab inside their nose. So maybe some of them were positive, and maybe she acquired the virus from one of them. And the problem is, here's the big problem, that because she is testing people, she could have spread the virus to normal people as well. And their tests will be negative initially, and then 2 weeks or a month later they can be positive, but they can be under the false assumption that they were tested a while ago, and they have this piece of paper saying that, hi Brianna, they have a piece of paper that says it is negative, so that now they're under the false impression that even though they have the virus, that they don't have the virus. So that's one problem. And another problem is this particular person who is tested positive, who's working, is probably not protected, because why would they acquire the virus if they're actually wearing a good N95 mask or a bigger mask, and if they're wearing protective equipment? So they're probably either not wearing the protective equipment, or they're not wearing it in the right manner, and now they're going to be put in quarantine for 2 weeks. So now they have to find somebody else to replace this particular employee. So these are all practical concerns. So I want to share the story with you that maybe the best option is to just stay home and just ride through. Even if you're having fever, just wait until it gets really bad before you either get the drive-through testing or you come to the hospital. In my mind, that makes the best sense, rather than spreading it or getting testing, because the problem is, even if the test is positive, it doesn't affect the outcome. There's no actual treatment for this. So I really wanted to share the story with you. The story makes a lot more sense to you rather than me telling you like what my thoughts and opinions are. So feel free to share this. I want you to stay safe at home. There's the grocery stores are still open. As long as there's food and water, most people are happy. So we'll see how long this lasts. So I know it is tiring. It hasn't hit Florida yet. There are some positive cases, but they're not really sick people that we have seen so far. So it may be coming in a month or two. I'm not sure when. So I'll keep sharing these stories to you. If you feel this is valuable, share a comment below, and also share with your friends. And if you ever need to talk to me privately, I'm available for that. And we offer a whole bunch of treatments here in the clinic. Feel free to chat with me about those. So look forward to talking to you all. Have a wonderful night, okay?